About 10 years ago, when the unregulated drug crisis was first declared a crisis in Canada, we were really dealing with a lot of prescription opioid drugs. As those became deprescribed, as there were more crackdowns on prescription opioids, we noticed that people were starting to use the street drug supply.
Across the last 10 years, the drug supply across North America has transitioned to be fully synthetic. So instead of heroin, we have fentanyl and its analogs. Instead of cocaine, we have more methamphetamine. These drugs are much stronger and can be made at the point of sale in people's basements, where the concentration and the strength is totally unpredictable.
What we're seeing is the democratization of drug production. So what I mean by that is that in the past, what we were seeing is that we were seeing more organized crime producing drugs and distributing drugs. What's happening now is that almost anybody can actually get the precursors of fentanyl shipped to them, and they can manufacture their own fentanyl, their own drug, in their own homes.
Pour moi, ce qui arrive en ce moment dans nos communautés, ou du moins dans la communauté de Hochelaga-Maisonneuve où je travaille, c'est la variation, le changement très rapide d'une batch à l'autre, mais j'ai goût de dire d'un approvisionnement à l'autre finalement. Là, parce que
Over the years, the toxic drug supply has become more toxic, more volatile. There are new substances in the supply that people who use drugs don't know that they're consuming. And we really saw this increase after COVID. There were a lot of different things happening that sort of created the perfect storm.
Et on les connaît beaucoup moins. Ça, c'est des substances qu'on connaît pas. Tu sais, moi, ça fait plusieurs années que je travaille au niveau du drug checking ou de l'analyse de substances. Puis on voit vraiment ça. Donc, on doit apprendre rapidement sur beaucoup de substances qu'on connaît pas.
So I would say as a clinician, I don't know what to expect with my patients. We're seeing weird wound infections. We're seeing people not being reversed from their overdose events with our standard doses of naloxone. We're seeing people going into benzodiazepine withdrawal from the toxic drug supply. It's highly unpredictable. It makes it very, very problematic for us to figure out what to do and what not to do.
The conditions that people are living under, we see so much more poverty and homelessness that contributes to chronic pain, disability, people using drugs for survival to stay awake when they're living outside. All these things contribute to the drugs being more dangerous and increase people's chances of dying as well.
One of the things I do hear from people is that they're less likely to use alone, which is key. It's one of our key interventions. They're more likely to carry an naloxone kit.
Donc, dans les 10 dernières années, je pense que les gens consomment plus de substances et de la polyconsommation.
Ce qu'on remarque aussi, les changements, c'est sur les modes de consommation aussi. Donc, les gens fumaient, après ça, repassaient un peu à l'injection quand le fentanyl est arrivé. Et là, ce qu'on voit en ce moment, c'est un retour à fumer, finalement, le fentanyl plutôt que s'injecter. Et je devrais dire aussi qu'il y a des gens qui font un peu tous ces modes-là en même temps, dépendant de certaines situations ou j'imagine ou équipements qu'ils ont sur eux ou de temps qu'ils ont sur eux.
These different modes of consumption are really changing how people are impacted by the drugs that they're consuming and the types of supports that they need.
Il y a tellement de raisons, puis les raisons sont pour tout le monde, chacun. Chaque personne, chaque individu va trouver les substances qui vont répondre à un besoin dans le ici maintenant.
People use drugs for a number of different reasons. One thing that we really see in Alberta, for example, is that there are a number of Indigenous communities that are disproportionately impacted by the toxic drug supply. And this is largely due to colonization, colonial violence, ongoing discrimination, and systemic racism.
Especially among people who are really vulnerably housed or unhoused. There's a lot of drive to use substances, to stay awake when you have to stay up for long hours, to walk all night long because you're being moved along. If you're really hungry but you're nowhere near food banks or anywhere to eat, it suppresses your hunger. And if you just want to keep yourself physically safe. And I guess another piece is if people are using substances around you, there's some social cohesiveness. When that's your family, that's how you're going to survive.
For me, I used drugs to fit in. I didn't know who I was. I wanted to belong somewhere. I didn't know how to express myself. I didn't know how to express my feelings. Like, I didn't know how I felt like I was alone. So using drugs, I felt safe.
We also know when working with people who use drugs that there can be a lot of trauma and unresolved harm that they've experienced in their life. That might look like challenges with their mental health. It might look like precarious housing. It can look like domestic violence or other sorts of adverse experiences that they've had in their life that they haven't received adequate supports for.
Substances hijacks our primitive need for survival. There's a part of our brain that's involved with survival through food and water. And what happens with substances is it hijacks that system to the point that it can no longer function or survive without the substance.
We need to make room for the entire experience of humans. And for many people, using some substances is actually helpful. For lots of us, whenever we use some substances, whether it's caffeine, whether it's alcohol, whatever it is that we're using, we use it in a way that if it's done where it's not causing a lot of physical harm to us, can actually be part of the color and the vibrancy of life. And
They're just people. That's all. They're no better. We're no better than them. They're no less than us. We're all the same. We just need to help. Just listen to them. They have some pretty amazing stories. There's some pretty gifted people out there that are using substances and out on the streets. Just get to know them.